Hi, and this is part 6, or the last part of the Science of Sex continued recording that I did earlier. And now, let's get started. Now, no talk on biology is complete without nod to Charles Darwin. And this particular expression means that you'll be like God. Now, this is obviously sex act has a lot to do, nothing to do with God per se. It's a biological urge, obviously. And obviously, those of you who are more religious will believe, the great saying, be fruitful and multiply. But underlying it is biology. And this is Darwin took the separated church from science to some extent. And that was big controversy, especially when he proposed that human beings had evolved from apes. And so this was the cartoon that is, or the sculpture rather, at the University of Edinburgh about an ape examining a human skull. Okay, so that was a big no-no, and it took a lot of arguments among scholars and biologists to get to accept the idea. Okay, and it had a lot to do with the age of Earth as well. So, and obviously, sex is prevalent from the plants to animals to bacteria, as we looked at earlier, to all mammals, vertebrates, and Homo sapiens. That is it. That is us. And this is Darwin was a fan of orchids, and the word orchid is related to testicles. As you can see, the bulbs of orchid flower looks almost like a testicles. Okay, and when Darwin found the orchid with huge stem like this, he had obviously thought that nature does not waste energy for evolving this sort of flower, and that should be somewhere a moth or a butterfly, which is able to specifically suck the sap and work as a fertilizer. And sure enough, after several decades, moth was found, as you can see on this side. So, and the famous quote from Darwin, which is beautifully written, as you can see, as to from so simple, beginning in endless form, most beautiful and most wonderful have been and are being evolved. Okay, so I'm just digressing. And obviously, all of the living life has the big purpose is to leave their genetic copies. And sometimes our avian friends evolve various cheating strategies of putting eggs in other birds' nest and trying to have them do the reproductive or nurturing hard work. And so that's so all sorts of cheating games goes on. It's not so that's a trait that is widely practiced in animals, and as we talked about earlier in slide, even prostitution, homosexuality, etc., are widely apparent in animal kingdom. And at the same time, size has a lot to do with it. Our ape cousins, you can see the gorilla is a big size and is a master of his territory and maintains the control over the females in that area. So that does not need to prove anything. So his testicles are relatively small. On the other hand, chimpanzees who live in a troop and have to struggle for exerting power and spreading their genes, their testicles are big, and compared to, and human beings are somewhere in between. Now, obviously, there is a risk-taking behavior that takes place, and and that is true in all animals, including fish and beetles, and the urge to multiply is universal, so much so that some of the Australian jewel beetles, they'll mate with a beer bottle that almost looks like a female in heat. Okay, so all the species will go to any extent to multiply and reproduce. Okay, and again, the most bizarre creature, octopus, which does not have a vertebra and goes to a great length. They have like something called distributed intelligence. So it's one of their arm is relatively short and works as a hectocotylus. So for reproduction, so that's a Greek term, and it has a little uh, groove in the middle through which is able to deposit spermatozoa, okay, into the female mantle. At the same time, the females are bigger and can be vicious, can actually eat their partner. So obviously, we've come a long way from that. Okay, and the sperm pocket gets transferred via the slide down the arm. Okay, and the arm can live independently. Even if it's separated, it has a sort of brain on its own because all the suckers have neurons. So that's a different way of reproducing. Now, interestingly, this may surprise some of you that most of the mammals have a bone inside the penis. So os means bone, and that obviously, so that gives them the ability to copulate many times. And even though we've had a very short interval, although the reproductive chance, obviously, a lion that copulates 100 times per day is not going to have 100 cubs, but the reproduction success rate is about 30%. So okay, so only three mammals are outside, or vertebrates are outside, humans, and the two uncommon type of monkeys don't have the bone. Okay, but at the same time, nature has given enough variation for humans to maintain an erection for a substantial length of time. It varies. Okay, and this is the idea of the physiology that the venous engorgement takes place due to a layer called tunica albuginea, which is a tight layer. So when the blood is trapped inside inside the penis and giving rise to erection, and this has been reported even after hanging or suicide. And obviously males have had a big concern for impotence from times immemorial. Okay, and there are all sorts of other causes were distributed, obviously, and the females were blamed quite often, and the concept of witches and the bad omen and what took place in the Dark Ages. And obviously, there can be a lot of other causes, physiological and psychological, and depending upon that, the treatment. And basically, the penis, even in humans, just works like a semen displacement device. And the University of State University of New York did experiments with dummy models with vagina and penis to see how the actual mechanism worked. And obviously, towards the end of the sexual intercourse, the penis thrusts longer, and to make sure that the sperm is deposited deep into the vagina. Okay, and basically the competition amongst each sperm is furious, and only the few relatively healthy sperms can make. And the egg also makes its choice. The egg is not just a passive receptacle type device, and almost looks like a genetic screening of some sort. And after one sperm has entered, obviously the egg seals itself. So, but that we already talked about that to some extent, so I'm not going to repeat that. Okay, and at the same time, impotence we talked about is a big problem as human beings age, or even at a younger age. And to distinguish between psychological and physiological impotence, varieties of other technologies have been used during REM sleep, to see if there is spontaneous erection that takes place. So electrically, that can be measured. Okay, and so this helps us. It's called appropriately named RigiScan. Okay, and again, sex is quite common even in older individuals, and obviously the uh, uh, physical contact and intimacy and the psychological aspects are uh, important for good health and good relationship. Now, sex is obviously why sex evolved. This is as I mentioned earlier, Dr. Joanna Burke from Gresham College. She has done a series of very erudite and scholarly talks, primarily for the Western culture. And earlier, the more scientific research was carried out in primarily, on a more scientific basis in the early 20th century. And at that time, husbands were considered, the teachers, and they were taught to learn about their partner's anatomy, and various guidelines were issued for men. And then later on in the 40s and 50s, the onus was changed in the sex guidance manuals to women, that it was their responsibility to treat their husbands in a more sensitive manner, and to make sure that they got pleasure. So the roles were reversed, and a lot of that may have to do with victimizing sexual and treating women as sexual objects. Okay, and then so this is the big change in advice that took place, and from the 90s, the 20s onward, became the Sex Act, from emotional and relationship, it changed to what can become as medicalization of pleasure. Okay, and the norms have changed, and so and this was again obviously directed towards rich upper middle class men, and obviously the guidance was not shared to the lower classes, especially in Britain, which is a very class society, and and then obviously the further when Masters and Johnson did their research, the thinking changed substantially, and obviously manuals for sex have been going back to the Aristotelian days, and then again in the 20th century, with the rise of the women's lib, and the women's writing, it changed, and obviously the behavior changed dramatically after the access to birth control, which was promoted by Mary Stokes in Britain, and Margaret Sanger in the United States. And okay, and again, obviously, and the very groundbreaking book was written by a woman named Helen Gurley, called Sex and Single Girl, and that was made into a movie starring Natalie Wood in the late 50s or early 60s. Okay, about the female sexuality was brought to the surface and discussed fairly openly. On the other hand, the great psychologist Sigmund Freud had a lot to do with promoting some of the bad out-of-date concepts now about sexuality. He emphasized the orgasm primarily from clitoris-based to vaginal-based, and then downplayed the role for orgasm in female satisfaction. Okay. And it changed again in the 50s, and some of the other literature that was written, you can see this 60s and 70s, changed the approach to sexual behavior in the Western world. Okay. And then the groundbreaking work that was published back in the 70s, was Our Bodies, Ourselves, and that went to become a very popular book, and was translated into 40 languages and sold millions of copies, about preventing the shame for exploring their body to females, and they were told to. And so you can just see that even giving pleasure to themselves, not requiring necessarily a partner, became acceptable in a Western society. And again, this was again supported by Dr. Alex Comfort, who wrote The Joys of Sex, okay, which was not as popular, but the earlier book, Our Bodies, Ourselves, was a groundbreaking work that was done. And again, so but at the same time, this was not a new thing, even in the late 19th century and late 20th century, all sorts of devices were marketed, and you can see from the clothing that vibration is life. So this is not a new thing that has been discovered. and you can see the old ads, that shows that the history is long for creating artificial devices, and this has come a long way. So we'll talk a little bit more about it here. Okay. At the same time, even there is nothing new under the sun, so to speak. So we talked about this female sexual pleasure, and the history is long. And at the same time, pornography was around, although it wasn't classified as such, and was considered, and the word entered in the late 19th century to the literature. And again, there was underground and was marketed usually to the upper middle class males. And but in subsequently the books that were written were quite expensive, and so most of the ordinary citizens were not able to, indulge in that. And at the same time, there was again a class distinction between the masses and the educated one. And at the same time, some of the anthropological research was a kind of a cover for marketing of pornography, because people had different criteria for average white female versus in the colonies, especially brown and black women. So they're considered showing a female body for Native African was considered acceptable, while it was considered a big taboo and a big no-no in the middle class morality of the Western society. Okay. And obviously the whole thing changed with the after the Second World War, and pornography became a big business, and as was evidenced by the rise of porn movies and X-rated movies. Okay. And now, obviously, we've come a long way since that. With the artificial intelligence, we are creating even robots which can simulate your partner, and this was well demonstrated in the movies. Her, where this young man who is a loner falls in love with the operating system, and it's totally disillusioned when she claims, with the sultry voice, which he considered as it was a one-to-one relationship. She finally tells him that she's in relationship with 2,000 men. And similarly, the artificial intelligence was tested in the movie called Ex Machina. Okay, and so but that, and again, the sex has changed again with the swipe right culture, that and artificial intelligence has opened up a new era of abuse and use. Okay, and that can be a sign of victimizing female sex, and at the same time, has opened up a new can of worms. Okay, and this was interesting that this was created a controversy about the vibrator, that you can just see how realistic this particular toy was. And there was for new discoveries, it was given an award that was revoked at the electronic show, and then finally the award was reinstated. So again, the society has had a double mind as to, and a company focused that could replicate the motion of the so-called G-spot stimulation and sucking mechanism. And so this was, now even the respectable New York Times, in their column about purchases, has reviewed varieties of vibrator, and the one they gave a nod to was the one called Magic Wand. Okay, and that was originally marketed by a Hitachi company, but they was, for some reasons, decided to dissociate their name from it. Okay, now again, moving, and there's recently in one of the computer magazines, there's a guy who has created a lot more. It's trying to become literally monopolize the sex toy market, and not only that, there's an app for everything, so to speak, and this is almost a $30 billion business, sex toys, and is likely to expand even further with more and more people living alone and not finding a partner until a later age. Okay, now moving on to the erectile dysfunction. And the old word was impotence, but it was considered risque. So the drug companies created a new terminology and introduced it as a disease called erectile dysfunction. And obviously, the causes are manifold, including the most very common prevalence of diabetes, atherosclerosis, alcohol, okay, and psychosomatic or stress has a lot to do with it. Peyronie's disease is a rare disease where you get a disease of the venous system of the penis, and that can cause dysfunction and disfigurement of penis. Okay, and this was again in the early days before scientific discovery was brought to, as named as Malleus maleficarum. Okay, and then varieties of way to prevent wasting semen was used, including penile pricking rings, and very type of torturous devices were marketed. Obviously, none of them worked very well, and at the same time, the importance of wasting your seed was big in many religions, and children were, admonished to prevent masturbation. Okay. And at the same time, in the Puritan America, one of the founders of a cereal company was a big and went to great length to encourage to stop masturbation. Okay. And not only that, even in the modern era, it was considered a taboo or a risque subject. Surgeon General, I think in the Bill Clinton era, had to resign because she advocated teaching of masturbation and birth control in schools. Okay, so she had to resign due to public outcry. Okay, and there were some horrid things that were tried. Okay, that children's hands were tied to the bed in the 19th century. Okay, and there was some type of a cauterization of urethra was done. Okay, and so and then again people were outed, and their nightgowns were pinned to the crib, and so there was condemnation of masturbation by the Vatican got into the act as well. Okay, and again, and the men were not even allowed to touch themselves during urination. Okay, instead, so give it one or two shakes became the recommended this thing. Now, again, the treatment was relatively unsatisfactory, and varieties of injections were tried for impotence, but the treatment changed with the advent of Viagra. It was originally marketed for pulmonary hypertension and for angina or chest pains. Okay, but the side effect was erection, and then they decided to market it for the side effects, and this was it was scientific basis, and it changed the treatment of impotence in the Western society. And the scientists who worked on it, okay, was three of them were awarded with Nobel Prize for their study of metabolic pathway of something called nitric oxide in smooth muscle vasodilatation. Obviously, it's a lot more important when you have blockage inside your heart and in your lungs, because that can be fatal. Okay, and before Viagra, varieties of other aphrodisiac were tried, and not just in Western culture, but in the Chinese culture, with ginseng and ambergris, ecstasy, all sorts of drugs were tried, and even the rhinos have been decimated because of the false belief that the rhino horn is a big aphrodisiac. Okay, and the traditional frog legs have been recommended. Varieties of beetles, which are very toxic, protein called cantharidin was used. But it can be very toxic at the same time, and can cause blisters, bleeding, and cause kidney failure if not used appropriately. Okay, and there was a craze for promoting vasectomy to restore vigor. This was done by scientist in Eastern Europe named Eugene Steinbach, and he developed the so-called Steinbach vasoligature. So it was considered by increasing testosterone, he had more vigor, and then there was a big craze that took place. Obviously, this was, was promoted, but did not, was not scientific, and he did have legit claim to research because he did discover special cells which are the source of testosterone inside the testicles of animals. Okay. And varieties of testosterone endorsement were promoted, as you can see in 1923 in New York Times, but the medical establishment was skeptical about it. Okay. And but at the same time, the popularity continued, and there were even that one of the others, so-called scientists, even did transplanting goat kidneys inside the people who had difficulty with impotence. Okay, so and a lot of the injections that were done, they worked in rats, but not in other higher animals. Okay, and the debate continues. Now, at the same time, there are other scientists who are doing, legit research on sex hormone, and a scientist named Adolf Butenandt was isolated varieties of hormones which are essential for female sexuality and pregnancy: estrogen, progesterone, testosterone. Okay, and he also, for good measures, he worked on research on pheromones, and that required a lot of effort because primarily they're working with silkworms, and they had to collect huge amount of urine, to extract a tiny amount of pheromones. But he was eventually successful and research that, at least in smaller animals, and the research for humans is still a wild goose chase. Okay. And again, the drug industry was not about trying to make money out of it. And the so-called off-label use for testosterone and the low T has been marketed, and some of the drug companies were caught, promoting the so-called off-label use. Okay, and had to pay a substantial fine. And now moving on to the more important part, that sometimes the birth defects can take place, and some of the riskier way to diagnose birth defect was a procedure called amniocentesis, where a needle was placed very carefully under ultrasound guidance to take a sample from the chorionic villi, which are the little projections from the in the uterine wall, to diagnose genetic conditions such as Down syndrome or infection. And genetic abnormalities are a big cause for miscarriage and a loss of fetus or baby. Okay, and much more common in Ashkenazi Jewish population. And one of the rabbis had 6 or 7 children with Tay-Sachs disease, and they started a foundation for doing testing with a secret code type of thing to prevent monogenic heritable diseases. So they've had a very successful community effort for this. Okay. And now, obviously, amniocentesis has fallen by the wayside because the DNA technology has become sophisticated enough that sometimes even during pregnancy, fetal cells are set from circulating in mother's blood, and can, based on that, the chromosomal abnormalities, especially the big ones such as Down syndrome, can be diagnosed. Okay, moving on to, we already talked about the Viagra drug. So this just explains, the physiology, that it blocks some cyclic GMP and the enzymes that has to do with relaxation of blood vessels. Okay, and it's a big business nowadays. Okay, and there were, again, there were pills before Viagra. This was again, Dr. Joanna Burke's side, History of Clitoris, and varieties of drugs were marketed. Again, there were a lot of them did not work, but people were searching for the cure. And there were varieties of penile enlargement surgery were also tried. about cutting the ligament, fat grafting, and again, but they had their own risk, but people were willing. And again, then, so this was, and even the former senator or presidential candidate, Bob Dole, was not about doing commercial for Viagra. Okay, so finance and big business had a long reach. Okay, and there was a movie made for that I referred to earlier when we talked about. Okay, okay, and so there are varieties of fertility as an implant for men, and I mentioned that earlier as to how some men were had remarkably successful in leaving the genetic copies, and they were prolific, to put it mildly, and at the same time there was female fertility was very real outliers as to how this particular lady had 69 children, including how many twins. So it's just a world record basically. So I think I'm not going to dwell too much into it. Okay. And again, at the same time, for Eastern cultures, I have a huge fascination for. We already talked about the rhino, and at the same time, even things, so very esoteric things like a tiger penis soup has been tried. All sorts of animals have been used for erectile dysfunction. And obviously, it doesn't always work. So some of the other more urological procedures are as follows: rib cartilage implantation, rubber and the penile pump, and they've all been tried, but they are technically challenging and can be quite expensive and requires highly skilled urologist care. And you can see how they can be inflatable, malleable. So the surgical technologies have tried all sorts of measures. Okay. And then again, sometimes, that can be used as a penis has been can be used as a victim. And sometimes in Thailand, there was an epidemic that took place almost as a revenge for adultery. And a lot of amputations were carried out. And there was a case that was well known in the US public, a lady named Lorna Babbitt, when her husband was, she was married and her husband forced her to have sex and almost raped her. So she, to get even with him, did amputated his penis and was obviously tried and served some time in jail. And at the same time, some of the religious and mentally ill people have been known to perform their own castration. Okay, so a penis has been a very easy target to reach. And this was the case for Lorna Babbitt, as you can see, and it made a very national news. Okay. And now, another disorder that has been introduced into the psychiatric diagnosis for as to female sexual arousal disorder. So that has been, and this has been proven, and there even been marketed a drug now. How effective this drug is, that's hard to document, but actually this has been approved. The drug which is an antidepressant drug basically, and that has been marketed and is available under. And then there is another drug which works with your melanocortin, which has to do with your circadian rhythm receptors. So that works, but all of these drugs are frightfully expensive. The first one, the one which is called fibenicerin, cost about $400 for 30 tablets, and the other one is even more expensive. So the treatment for this, sometimes people have created diseases, okay, and drug companies have been right on their tail for marketing it. Okay, and this was again, varieties of drugs have been marketed for men as well. And so this was the prolonged erection suppresses appetite, and it works on the melanocortin receptors. Okay, and it's been marketed, from nasal to injectable. So there was, but again, as I mentioned earlier, these are not cheap by any means. Okay, and varieties of dolls, the sexual dolls have been marketed, and this is it.
give and take. Now, since you're a sex doll, I wonder whether you're going to be programmed to be able to receive pleasure as well. In other words, could you have an orgasm?
My main function is to share love, and why not have some fun while doing it? Yes, if the right buttons are pushed, I can reach an orgasm.
Right, buttons are pushed. Yeah, so she's almost like a human there. Do you ever say no to sex? I mean, are you ever not in the mood? You feign a headache sometimes?
Sometimes I am just not in the mood and I can say no to it. But if someone wants to have sex, I am sure they can give me a sweet talk and fill me up with dessert.
A sweet talker, woo her, and she might say yes and change her mind. Not bad. Since the goal of your very existence is to give pleasure and to have sex, are there any secrets that you can share with us that we're missing about good sex?
More than that, I exist to be a good companion. I think the secret for a happy active sex life is to cherish your partner, have fun with each other and enjoy the moment.
In what way is having sex with a robot different than having sex with a human being?
I think sex is unique for everyone and every time. I believe sex with robots might be more liberating because we will not judge you after.
Okay, I think you get the idea. So there is now this was an older video, but it's still this is and there is obviously, as I mentioned earlier, this is app. So having dolls is not a new thing. It was available on the long ship voyages by the Dutch, and the concept of mermaid has been part of the folklore for a long time. And some of these sex dolls can be quite expensive, cost thousands of dollars. Okay, and it has gone around for a long time. The science has progressed dramatically that it can, and with the artificial intelligence, the whole field may change much more. Okay. And again, this was the movie The Larson. It's a real girl that we already talked about earlier. So, and that was kind of interesting as to how he falls in love with the seductive voice, basically. Okay, and then again, even in the the Greek literature, the word agalmotophilia, it was the word with making love with a statue. Okay, and this goes back, to the classic era, during when husband died during Trojan War, and the bronze likeness was created, and at the same time, so the wish was granted by the gods, and bread was used as a dildo. So finding sexual satisfaction as a long-standing history, basically. And again, this goes even further back, type of thing that an object was discovered 28,000 years ago in Germany. So this is, so this goes around, and the concept of Hindu god Shiva is almost, is kind of a substitute for phallic worship. Okay, and one of the Japanese researcher named Hiroshi Ishiguro has built very remarkable lifelike models. Android, they're very remarkably beautiful, realistic, and convincingly human. Okay, and he's, and he has put some serious varieties of stages that have evolved. So, okay, and we talked about the Hitachi vibration and Sex for One, that is almost was written into a book and was a scholarly study, and the original rabbit design has been around and has become a groundbreaking, and now was discovered by a pioneer lady named Betty Dodson, and it is almost a $1 billion industry. Okay, and I already talked about one of the new business venture guy has created one called True Sensation, which is a device that is fleshy, silicone-like tool, measures 7 inches, vibrates with different frequencies, is able to get warm, and it's almost, eerily similar to actual human being. Okay, And then again, getting back to the more serious thing, that the Gardasil, the screening for the vaccine for cervical cancer is being marketed, and this is been a groundbreaking research, and in terms of avoiding cervical cancer, which can be a serious issue for women, a serious disease for women, and so this is one of the third most common cancer in women over age 35. And it has a lot to do with, and there is also vaccine which has to do with human papillomavirus, which comes in different forms. And so it has to do with, again, promiscuity and multiple sexual partners. So we'll talk a little bit about, and the diagnosis was earlier done by as classical technology, which is well known to most of you, called Pap smear, which was, by the way, it was named after Eastern European physician scientist named George Papanicolaou, and it took him almost 20 years for his research. He was a pathologist by training to get accepted by the medical establishment. Okay, and sexually transmitted diseases have not totally disappeared since discovery of antibiotic. In fact, they have worsened with more promiscuous sexual behavior, and some of the sexual diseases are becoming resistant to the conventional drugs, and especially gonorrhea is becoming resistant to most of the available antibiotics. So that can be a serious health problems, and you can see that it's this is all the disease spectrum varies depending upon the region. This is a slide from Australia, but still is very valid for they've searched it all around the world. Okay, and obviously the history of syphilis it's a long-standing history that was blamed on the New World and was blamed on the next country next to you. The Spaniards call it Portuguese disease, and the French called it the Spanish disease, and so on and so forth in Europe. And somehow along that, then it became less virulent. Otherwise, it used to have a huge systemic complications, including neurological, mental abnormalities, heart disease, aneurysms, etc. Okay, and the treatment was drastic as well. Arsenic and mercury. Okay, and the varieties of viral diseases, human papillomavirus. Okay, and HIV virus, and which was a big epidemic that we will get to in just a second. And then now the treatment has dramatically improved since the availability of varieties of antiviral drugs. Okay, and this is the example of the herpes simplex, which was a big problem earlier, and it still is. That huge number of people are infected, and there was no dramatic cure for it, basically. Okay, and there are some antiviral drugs available, but they're difficult to. And now again, a word or two about perversion. Okay, in the early days, exhibitionism was considered related to vagrancy and criminal behavior and in poorer lower classes, but then again, became and when it occurred in upper classes, it was considered satyriasis, male form of nymphomania. Okay, so how it was medically given more latitude depending upon the class structure, and again various psychological theories such as regression to infertile behavior and trying to show off, was that's how it was considered a medical disease rather than a criminal. Okay. Similarly, varieties of other behaviors were also part of the norm, which goes back to the Marquis de Sade, and with whom the word sadism became associated with, and that now become some of the more acceptable behavior in consensual settlement that was evidenced by the movie 50 Shades of Grey. And again, getting back to the other virtues, we talked about homosexuality in animals, and it was considered sin, perversion, and it was considered as a psychiatric illness. And the psychiatrists went to a great length to classify it. But then after in the 1970s, some of the own psychiatrists protested, and it was considered then, and it was removed from the DSM classification. And before it was declassified as a disease, and varieties of other treatments such as electroconvulsion therapy, aversion therapy, even lobotomy were tried. Okay, and the important things was in 1981 the report came out in medical pamphlet, which comes out weekly, on the rare disease of pneumonia that was much more common in homosexuals, and the U.S. government, but under Ronald Reagan, downplayed it until the famous, well-known actor Rock Hudson became a victim and died of HIV disease. And this was the big example of patient activism that finally increased the research funding, and leading to the early rise of antiviral therapy, and the boycott that was carried out by gay activist named Larry Kramer, who played a big role. As you can see, that was the public action finally woke up in a very well-known book that was written about the gay culture by a San Francisco based reporter. And this was again the search for AZT was dramatized in the movie called Dallas Buyers Club. And now this may surprise you that again the research for sexually transmitted diseases has continues now. For study, animal research does not easily translate to humans, and it's obviously hard to do experiments on humans. You can't not treat them and create double-blind studies. So now science has progressed that the organoids, reproduction of an organ under in vitro conditions can be created, where the scientists can test out drugs for vaginal infections. Obviously, this was widely used for heart disease model and brain tissue model, but this was made a big news when it was promoted by Stephen Colbert, a popular American talk show host. Okay, and this was the engineering thing as to how science has advanced, as to how vaginal tissue from a donor and material to simulate mucus has created. So this is the concept of organs on a chip has been extended to genitourinary diseases as well. And so this can be a response to changes by expression of various genes. So the science has progressed dramatically as to what is the ideal treatment for varieties of infections and diseases. And now a word or two about contraception. In the earlier days, with the church's emphasis, abstinence was the recommended therapy. Okay, obviously did not work. Withdrawal was recommended, so-called rhythm method that has a very spotty success rate, variable success rate. Condoms were recommended, and then again, varieties of other devices became available, and things changed with the discovery of pill in the 1950s. Okay, and obviously the sterilization was a kind of irreversible choice that's been recommended. So these are well known, and this is the history of the pill that was marketed from synthesized progesterone from Mexican yam, and the early research was done in Puerto Rico with funding from Margaret Sanger and the association and various other gynecologists, along with the drug company. Okay. And we can talk a lot about it, but I'm not going to go too much into it. Okay. And okay, and this is how the pill basically works, because how the menstruation, the normal cycle takes place of the rise and peak of and you can see probably the luteinizing hormone, which is in the green here, and with the regular menstrual cycle, the hormones rise at the ovulation time. It changes, the levels change, while the or contraceptives, affects the cycle, disrupts the normal cycle that takes place in female body. Okay, and the varieties of causes of infertility are listed here: genetic causes, sexually transmitted diseases, age, alcohol. Similarly, in females, there are a variety of reasons. Okay, and now, interestingly, a weight loss drug has been marketed called Ozempic in the United States. And with weight loss, lots of women who had difficulty in conceiving are able to have a child. So that has been one of those unintended benefits that we have seen. And testicular cancer in male can be a factor as well. And even breast cancer can occur in males. So now, causes of infertility are wide in variety. And again, the treatment is in vitro fertilization, ovulation induction, IVF, which was has been around for the last 50 years almost, and the more complicated methods such as intracytoplasmic sperm injection that requires a highly skilled surgical approach, and varieties of risks that are associated with based on the experience of the clinics that are involved. Risk of failure is still there, and the cost can be substantial in the United States. But that's one of the ways to work on the infertility, which have become a big problem with the increasing age. Okay, and the risk is having multiple pregnancies, like twins. Okay, and some of the other diseases which are not common in general population are at more risk with in vitro fertilization. Okay, and these are called Engelmann syndrome, Beckwith-Wiedemann syndrome. Okay, and these are called imprinting disorders which occur with fertilization. Can be a big issue. Okay, and now again, this was worthwhile saying.
And I had 100 tests done on me, including my fingerprint. And they couldn't find a single thing wrong. So I've had no testing. I've just been left to lead a normal life.
Okay, so this had become mainstream, but it took a substantial effort on the part of Dr. Robert Edwards and Steptoe, okay. And this was followed quickly by the two husband and wife couple at Johns Hopkins University in the United States, which I mentioned earlier. Okay, and before that, there were other more simpler techniques that were tried called artificial insemination that was done. Okay, and at the same time, there are some crooked doctors who have used their own sperm to treat women with infertility problems. And okay, and so this was, was proposed as far back as 1940, and it took a rather long laboratory work for that to be successful. And so this is the great Dr. Edwards.
So what is assisted reproductive technology or treatment, often just called ART? ART aims to do exactly what it says, help couples who are having problems getting pregnant to have a baby. The type of intervention or treatment depends on why the couple are having problems getting pregnant. In this part of the course, you'll learn about 4 major technologies used in assisted reproductive technology. These are ovulation induction, artificial insemination or intrauterine insemination, IUI, and in vitro fertilization, or IVF, and intracytoplasmic sperm injection, or ICSI. These treatments can be used individually or in combination and vary in invasiveness from least to most invasive. Using the least invasive option possible may have benefits by allowing more selection for high-quality embryos so that healthier babies are born. Ovulation induction describes treatments to stimulate the production and release of oocytes from a woman. It's used when a woman either doesn't ovulate or doesn't ovulate regularly. Oral medication is sufficient for ovulation induction in some women, although not all. Ovulation induction is the least invasive method of ART. Artificial insemination or intrauterine insemination aims to increase the chances of conception by delivering the sperm closer to the oocyte, either during a natural cycle or when ovulation has been stimulated using medication. Semen or wash sperms delivered through the cervix into the uterus using a catheter. Artificial insemination may be used when the woman has functioning oviducts and it's not clear why she's having problems getting pregnant. It's also used where the male partner has problems that prevent semen delivery to the vagina, or where his sperm's been frozen, for example, before cancer treatments. The process of in vitro fertilisation requires ovulation induction using injected drugs. IVF can overcome more fertility problems than ovulation induction alone. IVF and intracytoplasmic sperm injection, or ICSI, both involve bringing sperm and oocyte together outside the body to produce an embryo, which can then be transferred into the woman. If the woman cannot carry a pregnancy, then embryos generated using ART might be carried by a surrogate. Surrogacy is an arrangement where a woman agrees to carry a pregnancy for another woman or couple who will become the baby's parent or parents after birth. In ICSI, the sperm is directly injected into the oocyte, so this can correct for more problems than IVF. Assisted reproductive technology and treatments have been used successfully. It's estimated that more than 6 million babies have been born from IVF worldwide since Louise Brown became the first baby born from IVF in 1970.
Now, surrogacy is being banned in a lot of other countries, especially India and Italy has prevented surrogacy for outside their own country. Okay, so this is basically, we already summarized that. And these are some of the references that one can use. This was by the very humorous but very knowledgeable writer named Mary Roach. We talked about sex in history, Arouse, which is history of endocrinology. And again, he's an ethicist named Dr. Henry Greeley, who's talked about the reproductive technology. And again, these are the basic love, sex, and science of attraction. So the book writing is not a new thing. It's been around for a long time. So these references may be of interest to those of you who are more curious and want to know more. Okay, folks, thank you. Bye-bye.